Ah, very good. So, welcome everybody. I'm Scott Hansen from the Open Group, and this is the MedSecurance webinar where we're going to share some of the results that we've achieved within the MedSecurance project. We have joining us some of our industrial partners that have been going through the evaluations process, just recently completed, as well as we also have on the call some of our R&D partners in case you have any questions. So this webinar will give you a little bit of an introduction to the tools and how they've been used by industry organizations in the medical domain. Also, we'll share with you a little bit on how you can get access to the tools and some of our plans for exploitation and dissemination. I'm going to start with just a brief introduction to the project. MedSecurance was founded just over 3 years ago to address the challenges that are arising from the use and increased use of various types of medical devices. They become very important in terms of diagnostic and care. We have a whole host of devices now, from wearables to bedside devices that continuously monitor and collect data or deliver treatments or provide support for smart medical diagnostics and monitoring, and a whole new set of services that are made possible by these devices, such as virtual care and virtual ward and remote patient monitoring. However, these devices also are, of course, connected to the hospital systems and the network, and they use various communication protocols. And with all of that increased connectivity comes increased security risks, both inpatient and outpatient settings, which can impact the safety of the connected medical devices and ultimately the safety of the patients that rely upon them. So MedSecurance was formed to really create technologies that address new methodologies, new tools, and evolving standards that allow you to create what we call Internet of Medical Things. We had the Internet of Things, and now we have medical things where everything is connected in the healthcare environment. And the tools and the methodologies that we've created in the project make the life for developers easier to provide levels of assurance and to detect potential risks and hazards in terms of the device or the healthcare systems in which the device operates. The project objectives have all been achieved. We set out first to review the current set of approaches for doing medical systems assurance and security analysis. We did a lot of research looking both within the healthcare domain, but also other domains to understand better how it's being addressed in other industries. We spent a lot of time developing a set of tools, which you'll hear a lot about as we go through the rest of the webinar today, that support and address the kind of needs that IOMT developers have in terms of addressing security, but also assurance and certification, being able to demonstrate that devices are secure and safe for medical use. And we've created a security assurance automation toolbox. It's a collection of tools that all work together, and they provide advances in terms of both modeling, ontologies in terms of how to handle requirements and specifications, and analysis, and being able to detect the kind of risks and potential issues that could come up both within the device and the communication protocols that are used to connect the device, and to be able to head off issues, but also to be able to respond quickly to any issues that might come up. What we've spent the last 6 months doing within the project, having developed the tools, is doing industry validation, and that's what you'll be hearing about today from actual healthcare stakeholders, both medical device manufacturers, hospitals, as well as healthcare service providers. And so we will be sharing briefly some of the feedback. And we've also been working to, we have created a set of recommendations to drive the evolution of the European regulations for medical devices, to really embrace some of the latest technologies and latest techniques, and to harmonize and to provide a much stronger and much clearer set of guidelines for medical device manufacturers. So we won't go through all of those today, but we'll just briefly mention the guidelines at the end of the webinar. We will hear from each of our partner organizations, and there'll be a chance to take questions and discussions. I'm not going to spend a lot of time going through this in detail, but these are the tools that are contained in the Security Assurance Automation Toolbox. We have established an ontology based on several different standards and being able to harmonize the terminology so that you can make very clear requirements in terms of what you want to achieve with security and assurance. We have a security level contract tool that enforces certain attributes and characteristics for exchange, even within the device or between the device and other devices, or even with the cloud. We have a set of IOMT modeling tools that allow you to model the devices or the healthcare systems to do model-based analysis of security vulnerabilities and risks, and to identify potential risky patterns within the architecture and the design of the system that could create vulnerabilities. We have an IOMT communication recommendation tool that you can introduce on a network in a hospital, healthcare environment, and it will analyze the current communications being used, identify potential risks, not only in the protocols that have been chosen, but how they've even been configured. So it's quite nice. It provides a lot of assurance in terms of the connectivity of the IOMT devices. And we also have a threat, vulnerability, and risk assessment tool. We call it TVRA, that goes through and looks at many different areas of an application, a medical device, healthcare system, to identify potential threats, potential vulnerabilities, and to suggest mitigation actions to avoid potential issues in operation. Finally, we have an assurance automation tool that pulls the results from the other tools together to help create and automate the evidence that's needed for certification. Because of the linkage to the other tools, as the device changes, it automatically identifies what evidence needs to be regenerated in terms of analysis or assessment in order to maintain compliance for certification. So all of these tools have been developed. They're available. You're going to hear about them today and some of the experiences that our industrial partners have had using them. The MedSecurance project is funded by the European Union. It's under the Horizon Europe program. It, as always, for these types of research projects, it's a collection of organizations from across Europe. I don't have time to introduce them all, but we have researchers from academia, researchers from industry. We have also industrial partners that you'll hear from today. The Open Group, we're a standards organization. We have a mix of both large and small organizations, and we have expertise in each of the tools areas. So we have quite skilled and very experienced R&D developers, and we have real life and experienced healthcare industry partners that have done the evaluations. In particular, we have regional hospitals from Portugal and Greece. Joining us today is representatives from Hospital Garcia de Orda in Portugal. We also have medical device supplier Stavida, who you'll hear from, also joining us today to present, as well as BioAssist that uses many different types of devices to deliver remote patient care services. We have a virtual ward provider, DACLA, and we have our stakeholder engagement organization that's been helping us reach out to all of the industry with the European Federation for Medical Informatics to create awareness, to drive the requirements, and to help shape the technology results and the recommendations for the regulatory updates. So the agenda for the rest of the webinar is to hear from our industry partners. We'll hear from Stavida and Hospital Garcia de Orda with their perspectives in using the tools from a perspective of a device manufacturer and a hospital in terms of their internal systems. And then we'll also have BioAssist and Hygia hospital represented to hear how the tools have been used to support remote patient monitoring and IOMT infrastructures. After that, I'll come back and talk a little bit about exploitation and how you get access, and then we'll have time for a QA session at the end. So with that as an introduction, I'm going to turn it over now to my colleagues from Stavida and Garcia de Orda, Rio and Gonzalo, and I'll stop sharing and you can take over from here.
Okay, thank you. Okay, I think I'm going to share my screen. Okay, screen 2. And You can see my screen now.
Yes, we can.
Okay.
Yes.
So, please, I think this is a joint presentation between me and Gonçalo, majorly Gonçalo from Stab Vida, and me from AGO. You see a new logo here because in the meantime, during these 3 years, the Hospital Garcia da Horta has converted into a unidade local. It's a group of healthcare units. So don't if the name is the name is interchangeable. So don't mind if the name is different here. Okay, Gonçalo, please. I think.
Okay, so we'll
Okay.
start with a quick use case overview.
Oh,
So the product under evaluation is the Dr. Vida Pocket. Dr. Vida is a portable handheld device for isothermonucleic acid amplification to detect viral genetic biomarkers. It is operated from any smartphone and can be used across multiple settings, including clinical and research environments, as well as at home. Dr. Vida is a multi-use pocket analyzer that processes single samples with a low risk of contamination, and it's guided by the Dr. Vida app. It's easy to use and delivers fast results while maintaining high accuracy. The Dr. Vida is a CE marked in vitro diagnostic device certified for use in clinical settings and has reached technological readiness level 9, meaning it is fully developed and commercially available. Overall, Dr. Vida represents a major step forward in medical technology, offering a rapid, accurate, and portable solution for viral infection detection. The Dr. Vida ecosystem includes three main software components: the Dr. Vida device, the mobile app, and the REST API with the back office. The Dr. Vida Pocket is manufactured in-house and combines hardware with firmware that controls the device operation and communication with the mobile app via Bluetooth Low Energy, while the diagnostic assay itself is performed on the device. The mobile app is used to pair devices, run tests, view diagnosis, and access previous results. The REST API and the back office are responsible for configuring test protocols and storing all the persistent information in an ACID compliant relational database.
okay.
So when it comes to business challenges and needs from Stab Vida's perspective, MedSecurance is an opportunity to address the cybersecurity needs of the Dr. Vida ecosystem in a structured and evidence-based way because Dr. Vida is portable and smartphone operated. It is well suited for clinical research and other point-of-care settings, but its security risks and assurance requirements must be truly evaluated to protect the integrity of the system. So, as a first step, Stavida aimed to identify the key security risks and assurance requirements associated with the current architecture, including the communication technologies already in use. And in parallel, Stavida also plans to strengthen protection against device tampering by securing both firmware and hardware against malicious modification. From HGO's perspective, there is a growing use of small IoT devices in clinical practice from ad hoc operations, and this trend is expected to continue. In many cases, these devices are introduced and adopted quickly to meet immediate clinical needs, which can result in cybersecurity and risk assessments being less comprehensive than required. And HGO considers that neglecting cybersecurity assessment increases the attack surface and creates opportunities for threat actors to exploit vulnerabilities, potentially leading to sensitive information exposure. In this context, HGO views MedSecurance as the chance to develop and consolidate a stronger, more systematic approach to cybersecurity risk assessment and continuous monitoring for IoMT devices, supported by a dedicated set of tools designed for this purpose.
Okay, and with that in mind, okay, and at this point, just like Gonzalo was telling, we had some common challenges, and just like mentioned, and we got a new set of tools. So and we were asked to how could we evaluate these tools? How can we help to evaluate develop these tools? So we thought about designing some evaluation scenarios that can follow the life cycle of a specific device coming into the on the healthcare provider network and into production, and until the time that they get monitored. So basically, we thought about and given that from a hospital view, we are much more concerned about the risk assessment and all the cybersecurity risks, and answering quick to the threats that are coming. We thought about on these 5 scenarios. Okay, the first one start with the risk assessment of the diagnostic device. We have a one device that it comes into the hospital. By the way, the history of this device on AGO, it was basically used during the COVID for diagnosis of COVID. So, and before using, the diagnosis was taking a lot of time. It was taking 2-3 days, but medical staff came with this device and started to get a diagnosis for the patients from 2 days to a couple of hours. So that was a major increase and much more efficient to triage the infected patients for the non-infected. So, but at that time we didn't do any evaluation, any cybersecurity evaluation, and any proper and structured. So we got a new device in place, but we don't know what are their capabilities. So our first scenario was to do that. Okay, evaluate that. Afterwards, the device needs to communicate through the network, because it has different network interfaces. So we need to check and evaluate the risk of the interoperability of that device. And afterwards, and in the third scenario, we need to, because at some point on time, doctors will ask us, or will ask to, okay, what if this device what if this device needs to export its data, its diagnostics data, to other devices outside? What are the impacts? So we thought about that scenario also. And for the managing and monitoring devices, the fourth scenario, we thought about, okay, we have a couple of devices that are in place already, and how can we monitor them, check if they are doing exactly what it's supposed to be, instead of doing something wrong, because it can be an indicator that the device is compromised. And in the fifth scenario, which is much more related with the Stop Vida activity, is how could a new certification could be prepared for new product introduction into the market. So with that in mind, we set up a very simple evaluation setup. It's basically, and it's something that it can be easily transposed into a production-ready environment, because all you need is one laptop in our case, we use Docker Desktop to run all the containerized tools that are available on the tool set. And then from that workstation, we interact with the different elements that compose our system. And even though if you don't want to do this approach, you can run the tools on a Kubernetes cluster, or we can run just like we've done the communication tool. It has a nice feature. It can run in an independent system on a specific IoMT network, so you can monitor the devices which are on that network. Sometimes it's more practical, and the networks are segregated on this type of environments, and it's more practical to segregate that monitoring where the devices are. And basically, if you want to start simple, the setup is not that, it's very simple, in fact. But if you want to level up to production ready, it's just a matter of hardening, changing the default passwords, customizing the tools for your specific environment, and it's also very easy to do it. Okay. So, and what we have done, we have run through all the, or mostly all the tools. Fortunately, we've defined some evaluation scenarios, taking in count that we wanted to see or check each moment of the on the life cycle of the device within our organization. We established those scenarios. Unfortunately, we could use almost, or I think all the tools. I think we've managed to have a look at all the tools. On the right side of the slide, you can see there are some outputs of the tool, which is very graphical. We can help, but the task we've done, and picking up that principle that we were more concerned with the risk assessment and with the security posture, and then assuring that the usage of those devices were not representing a threat to the patients. The first step, normally, we started with the complete the representation of that system, and for that we used the modeling tools. Either the modeling, the IOMT modeling tool, or even the cyber risk, which is on the TVRA tool. It were two tools that it could enable us to model and then perform our interactive risk analysis and identify the threats that were that were on that system, and then tweak it, apply the controls, reassess the outcomes, and check if we are already on a specific desired state. Okay. And this also gives you this approach can also this capability of generating the tools, generating the models. Sorry, we can generate outputs like the models itself, the assessments, all the reports that we can use for auditing purposes, evidence packages also for evidence, and the assessments we can reutilize for the continuous monitoring. Okay, so this is also important, the capability to reutilize these models and and it's significant because because systems change along the time, and now we started with the use case that we have. It's a small diagnosis device that fills in that diagnoses a specific patient data. Okay, but now the medical staff wants to input that data into another system. So that has, and it makes sense because medical staff, they tend to like to spend their time diagnosing the patients other than inputting data into systems. So it makes sense for that requirement to come along. But if what we can do with this tool is, for instance, okay, let's assess what happens if we introduce these new elements. What concerns do we need to take care? What controls do we need to apply to in order to do that full integration? And that was one of the interesting parts that we've done. We started, for instance, in the whole scenarios, we started with a simple model, and at the last scenario or the third scenario where we were introducing these new elements, we were just interacting with this first scenario and adding more elements, recalculating, assess the risks, and applying all the controls that we needed, or talk to the people that, if we insert this new element, we need to take care of this. And this is important because sometimes we think about or we think about integration, but take aside the security integration. Okay. Regarding the communication posture, it's I already mentioned it, but the communication the communication tool, the communication or recommendation tool has this capability to not only evaluate if our communication protocols and our communication configuration is safe, but also to monitor the devices. And this is particularly interesting because sometimes you get sometimes you need to get that visibility if what the device is doing, what the device is communicating to, because if there's a pattern on their communication that is away or skewed from the normal communication pattern, it might be an indicator that that device is compromised, and we need to act on that device to mitigate that threat. Okay. And regarding the last two bullets, those were more related with guaranteeing what Scott had mentioned at the beginning, assuring that our conditions are still safe even if we change one element. Okay, if we change from if we add a new element, if we still comply with all the recommendations and all the rules, and if and it has some automated tools that can also be very interesting. Okay. I think that's it for me.
So finally, what benefits can we gain by using the MedSecurance toolbox? So from a device manufacturer perspective like Stavida, we think that MedSecurance helps convert security requirements into clear outcomes. It supports compliance by producing evidence that the device follows our healthcare cybersecurity expectations, and it strengthens security by design by spotting weakness early when fixes are still fast and cost effective. And just as importantly, it generates structured the documentation that can be reused in discussions with customers and regulators, improving transparency and helping product reach the market with fewer delays. From a hospital perspective, like HGO, MedSecurance brings consistency and independent confidence. It enables evidence-based security assessments that can be repeated before deployment and revisited after deployment, which is critical for real operational environments. And it also supports verification of vendor claims, especially around secure network integration. So decisions are grounded in objective checks rather than just assumptions. And because it follows structured workflows, it simplifies evaluation and onboarding, making the process easier to manage across multiple solutions and vendors. Overall, MedSecurance creates shared value by making assurance more efficient and scalable. The reusable and automated assessment models support continuous monitoring and continuous improvement over time. This strengthens trust through better compliance and secure interoperability, and optimizes resources by reducing time and cost while reinforcing patient safety and data protection.
I think that's it.
Very good. Thank you very much, Ru and Gonzalo. We'll have time for questions and discussions during the Q&A session. So thank you for that.
Okay.
Very interesting perspectives. And I think for our webinar participants, you can see the diversity of how the tools can be used both for specific medical devices, but also within a hospital healthcare systems environment. So I think we can then move over to Vasilis from BioAssist, who will share their experiences in using the tools for their particular environment with remote patient monitoring and also supporting the IDEA hospital environment.
Yes, sir. Hi, everyone. My name is Vasilis, and I represent BioAssist.
Vasily, we cannot hear you well. The microphone makes some adjustments.
Just like having an alien.
It's chopping off frequencies of your audio.
Can you hear me better now?
Oh yeah, much better. There we go.
Right,
You're good to go.
So yeah, my name is Vasilis. I represent BioAssist and here Hospital for this webinar, and I will be giving you a short description and a demonstration of one of our use case scenarios that we tackled during the project, which involves the personal health record use case scenario. And to do the show, I will give a short description of two of the tools we used for this scenario. One is the assurance tool, and the threat vulnerability risk analysis tool. So first off, the BioAssist platform is a platform that allows users and patients to connect, upload the patient data, do teleconsultations with their doctors, and various other remote patient monitoring activities that are all include very sensitive data management, and basically there needs to be much attention to how the security issues are tackled, so that both the hospital and other entities are satisfied on the regulatory requirements. So one of the BioAssist platform's main functionalities is storing the patient's personal health record, which might include biosignals, various other diagnoses, allergies, and other stuff pertaining to the patient that are very sensitive information. And the challenge is when designing such a system is making sure that the network is safely configured, both in the platform and when it's deployed in a hospital environment, making sure that it complies to the industry standards, and ensuring that the data is stored correctly and in entities that have the jurisdiction to do so. To do that, we found it before using the MedSecurance tool. We found that this process was a bit slow because you would have to first consult someone for the regulatory issues and requirements, and then we would have to go and look on how we would implement those both on our architecture and on the system itself. So employing the MedSecurance tools, first off, ensures that their compliance with regulation is more facilitated in one complete system. And that is achieved by making sure that each tool uses evidence and outputs from one another to support and make more robust claims on certain actions that focus on the regulatory issues. And this is done quite easily by deploying the services using Docker. And that's what we did for our use cases. So starting off, we'll, one workflow that one would follow to achieve regulatory compliance using the MedSecurance tools would be to first start off using the assurance tool, where one would define some high-level abstract goals and use this system to produce more concrete evidence that one can achieve using one of the other MedSecurance tools. So for example, here you can see that one goal that has been set as a primary goal is to make sure that personal health records and any multimedia data from the BIOS platform are protected against unauthorized disclosure during collection and storage and sharing. This goal is very abstract, and finding a way to enforce it and convince other entities that it is actually followed is something that would take a lot of time. Previously, we would have to break this goal ourselves down and find the actions that would make its completion satisfactory. But using the assurance tool first, we can set a high-level tool and use it to produce many sub-goals that eventually end up into evidence that employ the user to use one of the other MedSecurance tools to produce the evidence needed. So for this, once we have used the assurance tool, we would, as you can see here, be tasked to use the IAM team-based engineering tool and the threat vulnerability risk analysis tool to achieve this part of the evidence. So I will be moving on with a short demonstration of how we would use the threat and vulnerability risk analysis tool to achieve that. And just give me a second to share the appropriate window. So here you can see that you first log in. Yep, and here we can manage all of our models using the threat and vulnerability risk analysis tool. For this webinar, we'll be more interested in the personal health record scenario. And first, we would load the scenario, the model, and of course, I have made this beforehand to save some time. You can see that the tool here has many profiles and components that are very neatly organized. So even one who doesn't have much experience with using the tool, but has experience with employing other modeling tools, could easily pick up this and create their own model. And this pretty much shows how patients upload their data to some cloud backend service, and how the hospital environment interacts with the patients. And yeah, basically during the creation of those models, one would add all those components, and eventually they would have to do a validation step. The neat thing about the threat and vulnerability risk analysis tool is that you can run this validation at each step, and you would get certain errors. Then you can mitigate easily by that are very explanatory, and you can follow actually steps to fix said issues. For this instance, for example, I would have to go and add a data center here. I could name it whatever I want, but I will leave it as is for now. Then I could run the validation step again, which would hopefully reduce the errors. And well, some still remain, so we would go on. We actually going through these, you can see that there is no jurisdiction for storage for extreme data, so that would lead us to go to the jurisdiction component and add it to the appropriate place. Running the validation again would make that issue go away. And for other issues, like this one that says that this data center does not have a manager, we can make an admission that it does have a manager, but we don't need to include it directly on the model. So this is easily applicable on the control strategies here. So once we have done that, we can actually go ahead and calculate the risk on this system. Doing so will create a hierarchy of issues that could be critical to the system. Clicking on each and every one of those has more detail into which component is affected, and at the end you could go and get some recommendations on how you could tackle those issues. However, this will take time, so we'll be skipping it for now. But you would get some more actionable suggestions that would reduce the impact and likelihood of the risk. And finally, you could also produce attack paths, which are helpful to finding other vulnerabilities into the system. And using all of that together and providing it and using all this together can be used as evidence for achieving some certification, some regulatory certification that would otherwise be quite more difficult to do and would require the usage of other much more detached tools. So yeah, that was it for my presentation for this. So Scott, if you want, you can continue. Can you hear me?
Yes, I'm here.
Very good.
That was it for the presentation.
Very good. Thanks very much, Vasilis. Thank you. So let me just put up a few slides just to talk about exploitation, then we'll take Q&A. Just have to find the share button. Okay, so hopefully you can see that full screen. So just briefly, because I want to leave time for questions. So the strategy for MedSecurance for these tools that you've seen and have been validated by our industry partners is all of the tools are available in open source. And we really want to continue to build an ecosystem around these type of security and assurance tools. We actually collaborate with some other projects that were funded at the same time as MedSecurance that are also creating tools. And we'd like to have a toolbox that supports all of the various tools. And so we've created an infrastructure and a process by way that we can share the technologies that we have, but also collaborate with others to include and provide linkages. They don't have to move their tools into our environment, but we can provide links and be able to share models and exchange information and collect evidence for assurance from different tool sets. And our vision for the future is to have this ecosystem that has many collaborators involved. We've been reaching out and already in contact with many different communities and software developers, researchers, and technology providers in this domain, third-party tool providers. And many times when you have a Horizon Europe or European Union project funded, it's always a challenge for longevity and sustainability after the project is finished. But in fact, within the MedSecurance project, we have a partner that business is actually to support industry participation and collaboration. So the infrastructure is there and the governance is there. And so we're able to continue to work with others and to continue to evolve the technologies and to accept contributions and other tools into the toolbox through a very open and transparent process. So all of the tools from the project are available in open source. You just have to visit our website at medsecurance.org. At the top, you'll see a tab for tools. Click on that and you can see the tools that were demonstrated by Vasilis and presented by our team from Portugal. And those listings will take you straight to the GitHub repos for the tools. There you'll find that the tools are available in Docker format. There's nice documentation. There's examples for each of the tools. So you can easily get started and get familiar and see how they can help your organization, either as a hospital or healthcare provider, or as a tool provider, or as a medical device manufacturer. We also provide support for stakeholders, different types of stakeholders, whether it be device vendors or health system vendors, people that sell healthcare systems to hospitals or hospitals themselves if they manage their own infrastructure, researchers and public authorities. We are able to provide customization and support services from various partners in the project. Biosys, as you just heard presented, is in the business of supporting remote monitoring and using many different types of devices so they can provide services and use these tools and to help others use these tools for implementing medical care systems. We also have other partners involved on Parallel Innovation from Portugal as our project coordinator. They provide services in this domain. CEA is a French research institute. They're a not-for-profit, but they also provide industry services. The Open Group, we provide services, and we have our academic partners from Spain, UK, and Cyprus are also active with academic industry partnerships, and arrangements can be made if customization of the tools are needed or support services are needed to be able to deploy and introduce the tools into your own environment. So we have in place the open source, and we have an open collaborative process to include additional tools. And the project itself will be going through the final weeks and reviews with the commission, but will continue to evolve the tools. Each of the R&D partners that develop the tools has funding to continue to evolve the tools. So the tools will not be put up on a shelf and left there. They will continue to improve and have new features. And as I said, we want to include additional tools from other projects and other sources that are interested in supporting our vision of this IOMT security assurance infrastructure, and to provide the best tools possible to those that are required to certify their systems for patient care. So that's what we're doing in terms of dissemination. Just one last point, which is we have a document that describes the updates to the regulatory, the MDCG guidelines for medical devices and medical systems that we've identified while the project is running, identifying areas that need to be updated, brought up to date in terms of technology, but also alignment with terminology, and taking a much more whole life cycle approach, secure by design principles, a whole list of things that we see as improvements that would make life easier for our medical device manufacturers and those that are going through certification, but also reduce the threat and the risks, because we'd have much more secure and less risks in any of these devices by using these new techniques and methods. And originally, this was intended to be a confidential document to be shared inside the regulatory community, and it is actually going through that process. But we think it's too important, and we've decided to make it public and share that with the entire healthcare community. In that document, there's also a proposed roadmap for how you implement and introduce these updates, both short-term, medium-term, and long-term. So it's something that we'll be pushing after the project is completed and going through, and we're continuing to work with the regulatory representatives, because these are really important advances, and the technologies allow you to do much more than you could do in the past. So that's a brief overview of how you can get access and where we're headed. I encourage you to visit the website at medsecurance.org. And with that, I think we can open up the floor for any questions or comments or discussion points. So I'll stop sharing, and we can take any questions that you might have. Any questions that you might have also for our industry partners from the healthcare industry, medical device, hospital? Right. Well, I think we've been very thorough in our presentations, or it's all very clear, or those that are listening would like to go visit the website and get more information. I see we may have a question here in the chat. That's a trick question. So the question is, what is the most advanced tool? So I would answer that in a couple of ways. I think each of the tools are moving beyond the state of the art in their particular area. So the communication recommendation tool is doing things that haven't been able to do before, and in a way that allows you to really understand what's happening in the network and where the vulnerabilities are. The assurance tool, automation has always been a challenge in assurance, because a lot of times it's a paper process to generate all of the evidence, and that's now been highly automated, and you can even tailor it to different types of certification requirements. So you can see I'm punting a little bit, because it's difficult to pick one tool that I would say is the most advanced. I think in terms of coverage, they each do a really good job, and they all of them go beyond the state of the art. So I think I'll leave it at that, unless one of my colleagues wants to jump in with an opinion. Then we have another question. Are there any limitations to your process? Some of my colleagues can jump in, but I think there are some, I wouldn't call it limitations. There's a learning curve, and our industry partners during the validation went through that process, which is, in order to use some of the tools, you need to, for example, model your system in order to be able to do security analysis on the model. So there's some ramp up to get familiar with how to model your systems if you've never done that before. It's also similar in terms of, for example, the assurance tool, where if you haven't gone through a lot of assurance processes, then you have to understand the way it's noted and the way it's structured. These are all kind of under the heading of formal methods and things that are needed for certification. And there's a little bit of a learning curve there, but each of our two of our smallest SME partners in the project have gone through it and have come out being able to use the tools and take advantage of the capability. So in terms of limitations, probably not. In terms of investment, there's a little bit of investment if you want to get the full value. Some other tools are easier to jump in. It depends on what you're trying to address in terms of security and assurance. Another trick question. So this is Orleo, you're giving us challenging questions here. What is the most lookalike tool already in the market? That I'm going to turn over to one of my colleagues, if anybody has an opinion how to answer that one, because there are modeling tools, for example, but the advantages for the modeling tool that CEA has developed is that it's open source and it's geared, and this particular environment has been geared towards medical device security analysis and modeling. And so, yes, you can certainly find other modeling tools, and even CEA provides more general modeling tools as part of their portfolio. But I think the advantage of the tools that we've created is they're specifically targeted for supporting medical systems. And a further question: is there a market for these tools? Is there something that companies and institutions are looking for as a service? So I think these tools are tools that are used because they're open source. They're tools that will be included within portfolios of tool vendors. So when you think of setting up your pipelines and your development environments, you get tools. Some of them may be open source, some of them may be commercial. If you are used to handling open source tools, then these tools will be quite easy to introduce into your tool chain. However, if you're used to purchasing services from, for example, a third-party integrator, there's a lot of large organizations that deliver healthcare systems to hospitals because hospitals don't want to develop these things themselves. Then we see these tools being adopted and used by those third-party integrators and system providers. Again, because they're open source, they can use wherever they need. But we also expect that there's some services around these tools. For example, there's expertise related to assurance. There's expertise related to risk mitigation. So the tools can help identify the threats and can make some recommendations. But there's also some services that can be built around using these tools and then providing the supporting services to address the vulnerabilities and to perhaps modify some of the designs of some of the devices. So there's definitely commercial opportunities around these tools, but we see these as enablers for those type of services, and that's why we make them available in open source. Okay, I think we've gotten through the questions, so some very good questions. Thank you for that. Then I think we've actually had planned to go for 1 hour for this webinar, so we've gone a little bit over. But I want to thank everybody that participated and encourage you to visit the website, encourage you to download the tools, and feel free to send us feedback. There's a forum where you can get in contact with us on the website. And if you need any assistance or have further questions for deployment, or how things work or how things can be put together, feel free to get in touch with us. We see it as something that's really important for the industry and something that will make a huge difference in terms of security and safety of these medical devices. So with that, I see one last question. Okay. Yep, I think we covered that one. So I think with that, we can say thank you, everybody, and close the webinar. And do visit the website, and we welcome further collaboration with everybody that participated today. So thanks. Have a good weekend. Bye for now.
Thank you.